OncologyTube exclusive video. In 2025, the U.S. Surgeon General advised updating alcohol warnings to include cancer risks, counseling patients, and promoting interventions. The study was led by Kenneth Morford, MD, addiction medicine specialist at Yale School of Medicine. Alcohol is linked to cancers of the mouth, pharynx, larynx, esophageal cancer, breast cancer, colorectal cancer, and liver. Globally, it caused 740,000 cases in 2020, 4.1% of all cancers, with 76.7% in men. In the U.S., alcohol contributes to 5.4% of cancer cases and 4.1% of deaths among adults 30 years or older, ranking third after smoking and excess weight. Alcohol's metabolite, acetaldehyde, damages DNA. People with ALDH22 gene variant, common in East Asians, face higher risks even at low levels. It causes inflammation, oxidative stress, raises estrogen for breast cancer, nearly 100,000 global cases, and heavy use leads to cirrhosis, a liver cancer risk. Other mechanisms include folate disruption, altered cell growth, weakened immunity, and microbiome changes increasing acetaldehyde and inflammation. Cancer risk rises with more alcohol. Lifetime risk is 25%. A standard U.S. drink is 14 grams ethanol, like 12 ounces beer or 5 ounces wine. Heavy use, 15 plus drinks weekly for men, 8 plus for women. Moderation, up to 2 daily for men, 1 for women. Evaluating risks is tricky due to biases in studies, like confounding from smoking, diet, or including former drinkers as abstainers. Heavy drinking over 50 grams, more than 3.5 drinks daily, raises risk for all 7 cancers, per a 2015 meta-analysis of 572 studies. World Cancer Research Fund confirms colorectal risk at 30 grams or 2 plus drinks daily, liver at 45 grams or 3 plus drinks. Low to moderate, less 1 drink daily raises breast cancer 10% in women, based on 100,000 plus studied. Light moderate accounts for over 100,000 global cases. Evidence varies, but NASM shows 5% increased breast risk per 10 grams, convincing dose-related risks even at low levels per WRF. Clinicians discuss risks, screen for heavy use, offer brief interventions, and treat alcohol use disorder with meds or counseling. Higher risks for smokers, ALDH2 carriers, or those with family history. Advise limiting to guidelines or less. If you like this video, share and subscribe. Visit OncologyTube.com for a web companion and more cancer topics. Thank you.